Hello, everybody. Today is September 14, 2021. Excuse my voice, I have a little bit of cold. Um, my patient is a 50-year-old Caucasian female. She has been seeing my nurse practitioner now for 7 months for management of PTSD, generalized anxiety disorder, and substance abuse. A little background on my patients. She is a she is a third of three children. She said that she had rough childhood. Her parents divorced when she was 5. Her mother then remarried 3 more times, and two of her stepfathers sexually and emotionally abused her. Patient has 2 children of her own. She now lives with her boyfriend of 2 years. She says she has no relationship with her siblings or her parents. Okay, we will now start with the mental status exam. Patient is well groomed, appropriate for the weather. She's alert and oriented times 3. Her affect appears anxious. She described her mood as anxious and depressed. She denies mania, hallucination, or delusion. She reported a problem with her temper towards her her boyfriend, and at work. She denied hallucination. She denied suicidal thought or any plan to harm herself. She's reported poor sleep. She said she had been sleeping between 3 to 4 hours a night. Okay, now we'll go to the DMS ISIS. ISIS 1, patient has PTSD, generalized anxiety disorder, and substance abuse, mainly alcohol. ISIS 2, our deferred. ISIS 3, patient has migraine, chronic migraine, hypertension, and pancreatitis. ISIS 4, psychosocial and environmental factor. Patient is doing poor. She has no relationship with her siblings or parents. She's a nurse, but they have fired her 2 times due to DUIs. So she just got a current job that she says she's so nervous when she goes to work. Patient says she has a neighbor, but they only talk in and out when they leave in their places. Her stressors now are her 2 sons were deployed to Afghanistan, so she's worried about that. But patient still drinks. ISIS 5, the global assessment of functioning, I'll give her 35. I'm giving her 35 because patient is taking risky behavior. She has DUIs, but she still drinks. She's reported. For my differential diagnosis, it will be panic disorder, because due to her risky behavior. She said whenever she gets in, she allows to drive to work in 2 hours on Saturday, but she reported that she has been driving places, hoping that nobody will stop her. Patient's medication, she has been on bupropion 150 milligram BID, Zoloft 100 milligram daily, and trazodone 100 milligram PRN nightly. Okay, what would be the plan for this patient? Her medications are working well, so we're not going to do anything with it, but we strongly encourage her to go to get counseling, and because to help her with her medication alone cannot do it, to help her with her emotional baggage from PTSD and from abuse but she's also reported that she drinks every night 6 bottles of beers, and this going weekend with the holiday she drank 12-pack. So she downplaying, limiting how much she's drinking, and it's very risky due to her work, and she already been fired 2 times, so she needs to take control of that. And also she signed a paper for us that if she doesn't stop drinking, we have to discharge her from the program. Thank you.